Okay, this question relates to COVID-19 social impacts. Other states have reopened earlier and are now experiencing spikes in infection rates and rapidly rising pandemic deaths. Although Hawaii's infection and death rates are relatively lower, there remains a 25% unemployment rate and long lines at food bank distribution points. As Hawaii begins to reopen for business and workers return to their jobs, do you think the government is doing all that it can to help or to keep the people safe? Okay, the order of the answers will be Scott, Lisa, Alan, and Colby. So at this time, Scott, you have the floor.
The government has not done enough to keep us safe during this pandemic. We're lucky that we have warm weather, sunshine, and isolation, because those are the things that have saved us from our leadership's failings. Now, this problem started way before the pandemic. You don't build your house on stilts after a tsunami. You do it before the tsunami. There was no preparation for this pandemic at the state level or the local level. There was no stockpile of PPE. There was no plan in place. I mean, to use one example that's not related exactly to safety, there was no investment in the unemployment office in case of a surge in unemployment. After this pandemic, our priority needs to be better preparedness for the next time. We need to start stockpiling PPE. We need to start stockpiling medical supplies. But during this pandemic, what can the government do going forward to keep us safe as we reopen the economy? I think there's two things. They can provide PPE and cleaning sprays to small businesses. There are a lot of small businesses that can't open right now because they don't have that PPE and those cleaning supplies. And if those small businesses can't open, the economy can't reopen. The tax collections can't pick back up, and we can't afford any of our priorities. And the other thing that they can do is better quarantine enforcement. I mean, we're having cult leaders fly here and flout our quarantines. We're having Instagram models fly here and flout our quarantines. The quarantine process of a single phone call per day, it's not working. We need to enforce the quarantine. That will keep us safe. Our current leaders have failed to keep us safe, which is their number one job. It's time for new leaders.
Okay, thank you very much. Lisa?
Thank you. So I just do want to appreciate our leaders for giving us the lowest death rates in the country and lowest infection rates in the country. They have definitely saved us from a horrible experience that people have had in other places. But yes, of course, we can do better. We can always do more. I have a doctorate in public health, as I mentioned, and I'm big on evidence-based decisions. We have great data. We can use it better. We should have closed our borders a little earlier, then we might have been able to keep our schools and our local economy open because we knew there was limited hospital capacity and we had no treatment experience. By May, we had flattened the curve, and at that point, based on the data, we should have started opening up. Now we are opening up and we have much better tests and we have much better testing capacity. For example, Dr. Scott Miskovich, who's been doing a lot of testing around Hawaii, he has a machine that turns around swab tests in 15 minutes. So we need to test more and collect more evidence. And the sad thing that just happened is we have these outbreaks in our nursing homes. They have very good protocols in place. They've been following since the beginning. But we can't wait for symptomatic cases. We need to do more testing, to do surveillance. So it can be very costly, but there's ways around it. You can do batch testing where you test an entire group together, and then if it's negative, if it's positive, then you can test individuals. You're much less likely to have false negatives when you do that, because in a group, more than one person is likely to be positive. Another thing you can do is just
15 seconds.
Examples of surveillance. So that's something we can do. And when they find something in any long-term care facility or jail or other high-risk group, then what we can do is go in with a crack team to do testing, training, and if there is a lot of infection among the staff, actually, if they need to be quarantined, we can replace that staff. So we can basically work on our hotspots much better than we are by using the tools that are available to us now with testing.
Okay, thank you very much, Lisa. Now at this time, let's hear from Alan Akal.
Thank you. To answer the question,
our leaders haven't been doing the best job. And I understand that it's tough and that, this is very unexpected. So it's not that they should shoulder the blame alone, because once the reasonable protocols are put in place, it's really on the community. And we've seen some great efforts by the community to address this. There's just an article that Wamanalo, which is part of our district, has 0 confirmed cases. And part of that is the community rallying to make sure that we protect ourselves, right? Once we have guidance, do that ourselves. But what we've seen is that the government has pushed the burden mostly onto the people and to the businesses to self-regulate. And I've seen it at the courts, at restaurants, at stores, where they put a sign and say, please don't come in unless you're wearing a mask. And if you have symptoms, please don't enter. That doesn't give me any confidence that every person is going to follow those guidelines and volunteer themselves to be experts and hold themselves accountable. So we have to do that. I think the best thing that we can do right now is increase funding for contact tracing. We got to know where these infections are. How can we track it and get good data, like Lisa said? But we also need to make sure that we have a long-term plan. And we've seen some miscommunications between state and county government. And we really need to be on the same page, because it is a public health care crisis. So we can't have any more division. Really, in addressing this, there needs to be unity. They want to fight about the budget and they want to fight about politics. They can do that, but public health should come first. So I think we really have to have some strong protocols in place, stronger than what we've had. As talked about earlier, quarantine enforcement. I work in the criminal justice system. Quarantine and stay-at-home orders were violated frequently. More than that was reported on the news, but we've seen it. And another thing we really, really need to pay attention to is maximum capacity. I think that's one of the things that's really going to help us. Is we need to get businesses open, but we really have to have them adhere to maximum capacity reductions. We cannot have hundreds of people at large events. We even have to make sure restaurants, hey, we want you open. We want you guys to be able to handle cleaning and the safe care guidelines. But we can't do that if we have maximum capacity pre-COVID. So those are the things I think we need to address right away.
Okay, thank you very much. And let's hear from Colby Chalk.
So, I believe that the state leaders are doing their best to address the unprecedented situation with continued PPE requirements and crowd limitations in place. It's easy for us or for anyone to say, oh, they should have done this, oh, they should have done that. Because the reality is we haven't experienced anything like this for about over 100 years. Nothing to this magnitude. And this doesn't come up frequently where we can say, oh, yes, it's going to happen exactly at this time period. So, I'd like to thank the leaders who have been actively playing a role in their community and making sure we can take care of this at every level, in the community level to the state level, county level. But that being said, that doesn't mean that that's the best thing we could do. Although what we have done to shut down our borders, to limit things, it did protect our kupuna and flatten the curve to make sure our state's medical infrastructure could keep up with the ill effects of this pandemic. Furthermore, we even have the fewest cases in the nation. That being said, contact tracing is one of the best things we can do, but we need to allocate more money of the budget, and that can be potentially from the COVID relief and the rainy day fund as well, that we could use that funds to continue to find more people that we could use to contact trace this back and make sure we can kind of take it out of the population here in Hawaii, so that we don't have too many people that we don't know about spreading this. And aside from what we have going on now, it's also important to look forward and see what we need to do and what we need to prepare for the future. Across the nation, we're going down in terms of the number of cases in general. And at this time, I think it's important that our government not only looks at what we have now, but also looks at what happens if another wave comes in the fall. Making sure that we can stockpile more PPE, sanitation wipes, other sanitation supplies, and basic consumer goods such as paper towels, toilet paper, in case there's a second wave in the fall. I think that's what we should be doing now in preparation for in the fall and next year as well.